Think I am live. Welcome to my first live. Can you all let me know in the chat if you can hear me? I actually had some technical difficulties earlier with the sound. So let me know if you can hear me in the chat, and also let me know where you're watching from. I always like to know where the viewers are. So welcome. We are going to get into the content in a minute. I just want to make sure you all can hear me really well. Also, I know it takes a while for the YouTube notifications to get to everyone before they can hop on. So I'll start in a few minutes. Excellent. Hi, Dee. Good to see you. Thank you for joining. I'm glad you guys can hear me. Excellent. Wonderful. Hey, Alabama. Okay, that's where you guys are right now. Thank you for joining in. I appreciate it. Where else are people joining in from? Let me make sure. Okay. So, guys, bear with me because honestly, this is my first time using StreamYard. But we're going to get into a couple things. So, I received a request from a few viewers to cover the questions that you should ask when you're seeking a physician abroad. And I've been asked this for those seeking care or treatment abroad, or who just may be a digital nomad traveling globally and they may need to find a physician abroad. So, that's the topic for today. And before we get into it, I should probably introduce myself before I forget. So if you're new to my channel, welcome. I'm Dr. Natasha Ramental, also known as the Medical Tourism RN. I'm not a physician. I'm a doctoral trained nurse. I have worked in the emergency department and post-anesthesia care unit for a number of years. And on this channel, I cover all aspects of medical tourism for Black women if they decide to seek healthcare or treatment abroad for anything. It could be something as simple as dental care, it could be cosmetic surgery, cancer, fertility treatments, whatever it is. But what I do is I try to educate Black women on things they need to know so that they can make the most informed decisions about their healthcare to have the best outcomes and also the best experience. So if this is of interest to you, please make sure you subscribe to my channel, hit the like button, and also the notification bell so you're notified when I post a new video. Okay. Oh, hello, Terry Ann Bartley from Connecticut. I see we have Olayinka. I hope I didn't butcher your name. Watching from Providence, Rhode Island. I have family in Rhode Island, a niece. Thank you. Can. Okay. All right. Can, not can. All right. Good to see you all. Thank you so much for joining. We are going to get right into this. As I said, we're going to be talking about questions to ask when you're seeking a doctor abroad. Okay, so there may be many reasons why you might be looking for a new doctor, right? You may have moved to another city, another country. As I mentioned earlier, you could be a digital nomad who's just bopping around the world. You may need to seek out a physician, or it could be that your doctor's even retiring. Whatever the case, if you need a new doctor, these questions are going to help you find one who's right for you, things that you need to consider. Obviously, you should pick the questions that fit your situation best because there may be some nuances that are based on the type of doctor you're seeking, the treatment that you're seeking. If surgery is involved, you may need to ask a little bit more detailed questions, but I do have some extra questions for those seeking surgery. But then also you got to think about some other things like your age. Also, it's based on your health condition. You may already have an existing illness that you're managing, or you may need to manage better, or you're a part of a particular population where you need to make the clinician aware of in order for you to receive the best care and outcomes. And by that, I mean you could be part of a disabled community, LGBTQ+, whatever it is. So we'll get into all of that today. And if you guys have any questions pertaining to today's topic, feel free to drop them in the comments and I'll try to answer your questions as I go through and share these 20 questions with you. And I said I was warning you ahead of time. I'm literally learning how to navigate StreamYard, so just bear with me, okay? But these questions, they're in no particular order. And some of these questions you need to ask as you seek out a doctor abroad. And then there's other things that may come up depending on your situation, okay? Let me see. Oh, before I start, I see Dee, you mentioned what about preventive screenings? Yes, we're going to get into all of that because there's some things that you need to consider with when you're seeking any physician, whether it's for primary care or something a little bit more detailed, maybe a specialist or even for surgery. So we're going to get into all of that right now. Okay. All right, so first question, we're just going to get into some basics. Is the doctor taking new patients? Sounds very basic, right? But a lot of times when someone's seeking a physician abroad, what happens is if you happen to know someone that lives there, whether it's friends, family, or you have encountered a community online, maybe through online communities of Black people or Black women in that particular country where you're seeking care. A lot of times you guys can get recommendations, right, of who is a good physician to see. That's well and good, but it may not apply to you at the time you plan on traveling there. So you do want to know something as basic. Are they taking new patients? And if so, when you plan on being there, so that you can make sure that this person is even available to see you if you choose to go with this particular physician. Okay. Another question, number 2, does the doctor accept your insurance? So some US-based plans cover you abroad, depending on where you're going and the circumstances. And I'll just give myself as an example. So I work for a global company, but it's based in the US and I work remotely. So my insurance covers me wherever I am on the globe, because I do have location freedom where I can travel and it's not an issue. So whenever I plan on going abroad, what I do is I tend to contact my insurance carrier, tell them where I'm going and for how long. You don't have to tell them for how long. I just happen to tell them that it's usually a month or less, right? And so what I do is I say I need to know who's there that is not only like primary care, but then I have 3 young children. My husband and I may travel with the children. So I may ask if there's a pediatrician they can offer, any specialist related to any things that may be applicable to me and my family situation. Okay. In other cases, you may actually decide, if you're traveling to a particular country, maybe you're doing a scouting trip or you're a digital nomad. You want to learn about health insurance there, or if you are going to be there for a significant amount of time, like a digital nomad, it might be more beneficial for you to either pay for a local insurance plan or an international plan. And in some cases, honestly, simply paying out of pocket, because the cost is such a small fraction of what you'd pay in relation to the US, that once you determine your insurance needs, you need to at least see what works out best for you guys in that case. Okay. So I want to make sure that that is clear, because the insurance thing comes up quite a bit, what's covered, what's not. What I'll say is, a lot of times, and I'm hearing a lot of people who are interested in either moving abroad, traveling abroad, whatever it may be, the concern is always healthcare, rightfully so. Safety and healthcare are among the top. And one of those things that I always tell people is, listen, if you look into your options, you really will find that you get a better bang for your buck when you leave the United States, for cost, but then also for quality of care. You're going to find that a lot of things that are considered outside of the norm, like home visits and things like that, all those things are kind of standard in other countries. They don't really cost you extra. So these are things that I want you to consider when you are thinking about a physician abroad, okay? And all of that insurance talk will lead me to number 3. Number 3 is your doctor a preferred provider under your insurance plan? And that may be more applicable to maybe a US-based plan, but it's something that you need to think about, because even if you were to obtain a local plan in whatever country, or an international plan, you want to make sure that this provider is under it. They want to know how they're going to get paid. And if they're not under that plan, you will pay out of pocket. And if so, how much, right? It could still be a nominal fee for you, but you want to know before you actually get there and get engaged in conversation and they see you and things start to add up, and it might be outside of what you budgeted for. Okay, so that's really important. All right, number 4. It's important to determine a doctor's qualifications and background. Okay, so is the doctor board certified? And if they are, in what field? Okay, they could have gone to medical school, but many specialties require additional certification for specialization. So you want to make sure that they are board certified by a regulating body, and that regulating body can be local or it can be international. And let me give you an example. In Turkey, I know it's really highly regulated, so a huge spot for medical tourism, and rightfully so, honestly. The prices are amazing, but then on top of that, they have so much regulation locally, and they follow international standards as well. I know that what they have is physicians, specifically surgeons, a lot of times they go through additional training, and that's anywhere. But then on top of that additional training at Turkish regulation, medical regulation boards, what they do is they actually send out actual doctors before you do your first specific surgery that you acquired additional hours for. So they go and make sure these physicians are watching you to see that you're doing it appropriately. And they also have a registry online that you can access to see doctors and their certifications that they have, their specialties, and any dings against them. So that makes them an ideal spot to seek out additional people who want to engage in medical tourism. So that's something that is really interesting. So research the extent and training and clinical experience of maybe a prospective physician that they have, specifically regarding specialty procedures. If you're going to go into surgery, because not all physicians are trained in performing like a full array of procedures, and they may actually refer certain cases to their colleagues because of that. And a referral may be a less convenient option for you if you're traveling for this procedure. There are other things you would need to consider, like additional cost, time that you need to be there, things like that. But I encourage you to find these things out prior to traveling by having a discussion with the physician that you plan on seeing, okay? You need to interview them. It's to learn about the procedure, how they'll conduct the surgery, how you also need to determine if you even like their disposition or their bedside manner. That's important, right? They may do these surgeries on different patients all day long, but there's only one you. Okay, so I want you to be sure you feel comfortable that a physician's knowledgeable, and when you ask your questions, that they're patient with you and that they can fully explain the answers. It's not the time to be shy. It's your health. That's really important. Okay, so I want you to be mindful of that. The next one, number 5, is the age, gender, race, or religion of a doctor important to you? Okay, and this, depending on the country you go to, you may not have any options when it comes to race and ethnicity, or even gender and religion. And I say that because if it is important to you, I want to make sure that you are seeking out those who fit the bill for what your interests are. If you're concerned about them being too young, or you want only female physicians, or if you want a religion specific to your religion, those kinds of things, you need to seek all of that out. And it's open when it comes to those kinds of things. When you're sort of going through the interview phase, it's kind of common to ask some of these questions. It's unlike the US, where it's a little bit taboo to sort of ask some of those things. You're just going off of what you see and say, oh, no, I don't necessarily want this one, or why. Right? So think about that and determine if that is of importance to you if you're going to travel abroad for treatment or care. Number 6, will language be an obstacle to communication? And this is a big issue if you're going abroad, even if you're not seeking treatment, right? But is there someone in the office who speaks your language? Whatever that language may be, you want to make sure that you're covered. You want to make sure that they understand. There's no reason for you to leave anything up to interpretation when it comes to your health. If you say you understand a little bit or conversational Spanish when it comes to your healthcare, you need to have someone that is giving you that in your native tongue. Okay, that's how important it is, especially if you're talking about treatments like, say, IVF, cancer treatments, or any type of surgery. When you're kind of looking for primary care, or even light dentistry. By general, I mean like cleanings, not so much the reconstructive care, which is surgical. In those cases, you probably can get away with that. But when it comes to surgery, really long-term type of treatments, those kinds of things, you really want to make certain that you're on the same page and that the language doesn't become a barrier for your care. Okay, really, really important. Let me see, hold on, there's a question before I move on. Similar to the US, do other counties have certified medical interpreters? I'm gonna assume that you're saying countries, D. So some places do and some do not. It's not a requirement, but what we've seen is that a lot of places will appeal to English speakers because they know they're typically coming from, say, the US or maybe even the UK or Canada, and they're coming with dollars, which overrides a lot of things. So you'll find that they will not necessarily have them on staff all the time, but they have the availability of them if they know you're coming for care, right? They can attract a lot more patients that way. And we're going to get into that type of communication as well, because that plays a role in your cost. So in the US, it's a law that they must have interpreters or translators. There's actually like a phone line that like every hospital has with every language you can think of. And they just essentially, if it's not offered in the hospital, they call this line and they get someone on the phone while you're caring for the individual. Not the case everywhere. So that's something that you need to factor into your cost, because what happens is I'm hearing a lot of people who go and they specifically want maybe an English speaker, and the English speaking physicians cost more. And it's simply because they know they're in demand. They can do that, right? It's not overwhelming in terms of the cost, because if you factor in all of the services that you are actually going for, if you were to compare those same prices to what you pay in the US, it's nowhere near what you would pay in the US. However, it's a little bit more. Nothing is going to break the bank because they speak English, but it's something that you need to consider in your own budget. Okay. All right. Next, number 7. Have they cared for patients with medical conditions that disproportionately affect Blacks or Black women? So I'm unapologetic about this channel being catering to Black women, right? But considerations for Black women, you need to understand that you have to ask about these things. So Blacks, not only women, have certain medical considerations that are often unaddressed. Anemias, specifically sickle cell anemia, but anemias are pretty common. However, Blacks are over 3 times more likely than their white counterparts to have anemia in the US. And with sickle cell anemia, that's an inherited gene primarily affecting Blacks. So your clinician would need to be made aware of this condition and how to appropriately provide you with the care you need if you were to have, say, an episode of what's called sickle cell crisis, which is extremely painful. It's almost what someone would consider a flare-up. Also, sickle cells that they block the blood flow to your organs and deprive the affected organs of blood and oxygen, which can result in a number of life-threatening complications. So things like that, you want to make sure that they are aware of it. I'm not saying that they have to treat that on a regular basis, because maybe there aren't many Blacks in whatever country you decide to go to, but are they trained on it? Are they familiar with it? Do they know what the signs are to look for those types of things, other than maybe a patient saying, I don't feel right? Okay, because what if you're in a situation where you can't speak? You're still under anesthesia. They need to look for these things. So that's the reason why I say it's important that you bring something like that up. Another condition that disproportionately affects Black women in particular more than anyone else, PCOS, polycystic ovarian syndrome. That's a hormonal disorder, but Black women are disproportionately affected by PCOS, and it affects Black women more severely than their white counterparts. So Black women with PCOS may have higher risk of cardiovascular disease or even metabolic syndrome. So they experience excessive weight gain that leads to obesity, which obviously is a major factor for fertility or even for any surgery, right? And then, of course, Blacks have the highest rates of high blood pressure and diabetes in the US, but because these are more common, the physicians might be well-versed in the blood pressure and diabetes. But PCOS, sickle cell anemia, things like that, you want to make sure that you're asking whatever physician that you are seeking care from, whether or not they have experience with that, okay? Oh, thank you, Dee. Dee says, thank you for talking about anemia. Iron deficiency is her focus. Yeah, it's real. It's a big deal, especially in our community. So we want to make sure that you guys have as much information to ask a physician about before you sort of jump in, and then you have to find someone else or they have to find someone else. And you don't want a situation like that, especially if it turns into an emergency situation, right? All right. Number 8, do I prefer a group practice or an individual doctor? It may sound basic, but let me tell you why. This is important for those that may need to see a physician pretty regularly, okay? And if the physician has a full patient caseload and may not always be available to answer your questions or easily accommodate appointments in a timely manner, they may be part of a broader physician group, a practice where you can see any physician within that group who will have access to your patient records and still be able to see you. If this is important to you, you should ask to meet the group. Okay. If you are concerned about the group, or maybe you don't, if you know that you just want a physician and they all work in the same office, that's fine. But if you happen to get one that works in a physician group, you should ask to meet the group, not only that one representative of the physician, because as you guys know, bedside manner, the whole way they deal with you, it may differ from one clinician to the next. So you do want, it's important that you meet all of them. I think I would suggest that you meet all of them. I would. Okay. All right. Number 9, how far in advance do I have to make appointments? This is huge because obviously you don't want to have to sit and wait several months before you can see a physician, especially if it's like primary care, right? Or a specialist. Maybe you're handling a chronic condition or autoimmune issue where you need to be seen pretty regularly. You don't want to have a physician where you are essentially waiting months upon end to get in or squeezed in. Okay, so think about that too. If you find their patient load is too heavy, where making appointments is going to be difficult for you, that might not be the best choice. Okay. Number 10, location of the doctor's office. Okay, this is important for a couple reasons. So, how far are you willing to travel to see a doctor? Wherever you decide to go, if you're going for another reason, maybe you're going for a scouting trip, you're going for sabbatical, you're going digital nomad, or you picked a random place and said, I'm going to be here. You may decide to live off the beaten path, maybe in a rural area, and it takes a lot of transportation to get you to where this particular office is. Those are the kinds of things you need to be thinking about. How far are you willing to travel to see a doctor? What does it cost for that travel? Is the office on a bus or a subway line? Is Uber or some other transportation costs involved with this? If you have a car, is there parking? Like, those are the kinds of things that you want to think about. You want to know this in advance because maybe you'll need to follow up regularly, which can cut into your budget depending on how far and how frequently you need to travel to the doctor's office, or even for like related places for tests, blood work, imaging, whatever it may be. Do they have a pharmacy on site? You want to know all of these things because all of that factors into your visit. Are you going to one building, or are they going to send you to several different places? And are those places even close to where they're located? Okay. You also may get prescribed meds ahead of time to ensure you have like quality prescriptions, those kinds of things. When it comes to that, you want to make sure that the clinician knows what you're currently taking, because it may be the same medication, but in another country, it's called something else. So you want to make sure that they know what you're taking, have a full list, because if they have a pharmacy on site, that may be something that you can obtain refills from them that's there, or you may have to travel somewhere completely different to obtain that. Okay, so that's something that you want to think about as well. All right. Oh, please hit the like button. Thank you, Shana M. Thank you very much. I appreciate it. And subscribe. Yes, Dee. Thank you. Thank you, guys. Let's get into number 11. Okay. You want to ask what services they offer in-house. Okay. The example I just gave, if you need blood work, imaging, pharmacy, all those things, is that done at their office? And if so, can they provide a price list? The price list doesn't even have to be exact. They just need to give you an idea so you can factor that into everything you need. I mean, blood work, imaging, all those pieces, those are that can go really high, particularly the imaging more than the blood work, right? But that, and then pharmacy. So that's something that you want to make sure that you are asking about in advance, and ask for a price list or estimation of a price list. Okay. That obviously leads to cost. Overall, number 12 is going to be cost, because the cost of care can fluctuate significantly from case to case based on a variety of factors. And that includes the location of the doctor's office, like I just mentioned, whether they do services in-house, but it can also vary based on whether it's in a more say a more popular city, a big city versus rural. And this happens everywhere. An example I can give, and I'll just give them from the US. In the US, like a physician that might be in, say, Beverly Hills, California, they may charge 25% more for the same treatment performed in outlying areas such as Thousand Oaks, which is less than an hour away. Why? It may cost the practice significantly more to operate in an area like Beverly Hills, which is upscale. And those costs are now shared by you, the patient. Okay. This happens outside the US as well. And this may be the case, but think about costs also being higher for the English speaker, in addition to that person being in a popular city, like maybe the capital of that particular country. So before selecting any given physician, make sure you get your estimates, because you're going to need to know and factor all of that into your cost overall. Hi, Tonisha. I hope I didn't butcher your name. Thank you for joining. No problem. You're late. We love it. I'm glad you're here. I just saw, I passed D, you mentioned, what about using a physician outside the US for a second medical opinion? I'm all for that. Honestly, I'm all for second opinions, number one. But I certainly think that it's worth going outside of the US to get Tonisha. Okay, Tonisha. What about getting a second opinion from a physician abroad? I would do it myself. Honestly, I'd probably get 2 opinions in the US, and then I'd probably choose to seek care elsewhere, depending on what it is. If I felt it was going to be something that might cost a lot of money in the US, and I'm not trying to go for broke here, or maybe, and I've seen this happen too, where you may be for a particular treatment. I've seen specifically when it comes to a cancer diagnosis, maybe a patient decides, I want to go the natural route, right? I'm more holistic. I want to do it that way. Insurance in the US does not pay or cover for holistic treatment, okay, because they say there's not enough studies to verify that this is effective, even if it is effective. But they don't want to move towards that. And I'm just going to say, because it's pharma, big pharma in the US. That's the reason why they don't want to move towards that. If I find that a physician is not willing to hear me out and go in the route that I desire to go to try, I would probably just go ahead and take my records and say, okay, I won't even tell that physician. I'll just take my records and go somewhere else outside the country and see what can be done. Because honestly, every other country seems to be more open to holistic methods than the US. And that's a combination of reasons. It's cultural. There's price weighs into that as well. If you don't have as many resources for some of these high level machines and tests and things like that in your own country, you tend to find a way using what you have. And I find that to be amazing, so I would be more than open to getting a second opinion abroad. Absolutely. I think that's really great. So that's one. Number 13. Does the building have an elevator? What about ramps for a wheelchair or a walker? This is something that obviously is important for everyone, but a disabled community, for those traveling from the US, where there's not a lot of equivalency of the American with Disabilities Act in several countries. So if you have a physical disability, you need to consider this in your country that you plan on traveling to or moving abroad to, and how that may impact your life overall. Okay. There are also not a lot of laws pertaining to protecting one's civil rights against discrimination over age, race, color, religion, gender, sexual orientation, national origin, all of those things. So think about it. And I know even if it's something that's exists in the US, at the end of the day, whether people follow it or not, you know that you have a course of action because there is a law, versus in some of these countries where a lot of that doesn't exist. Just because the infrastructure might not be there. There are different priorities of the country. So just think about it. I think it's really important that you guys look into what would be best for your specific situation. If you know you use a walker, a wheelchair, even a cane, and you know you're moving to a place with cobblestone streets and nothing but hills, and there's no elevators in a number of the buildings that are there, think about what you're getting into and what that will do to you and your body, and what help you may have too. I mean, some people are fine with it if they know they have help. If you're moving alone or cannot afford to have additional help, that's another story. And it's something that you need to consider. Okay. Let me take Tanisha's question. If you want to move abroad, should you contact the doctor's offices in the city you are going to before, or wait until you move? I would do it before, Tanisha. Do it before. That was something I was saying. It's key for you to find a way to interview as many people as you can before you go, because you may have a recommendation from someone. You contact them, ask a few questions, and what if you don't like what you hear? You don't want to wait until you're there. You want to still be able to have a couple options to interview before you even get to that point. So yeah, for sure. Definitely beforehand. Absolutely. All right. All right. Now we're going to move into knowing the doctor's office policies. So number 14, what days or hours does the doctor see patients? This is important for you for a number of reasons, depending on where you're coming from in terms of transportation and how you get there and the times that are the transportation's offered. All of those pieces matter. But then also, if you happen to be, say, the scenario is a digital nomad and you're working X number of hours, because some people will travel across the world and they're on really odd hours of the day, because those are the hours that are business hours in the US where they may be based, but they're in the middle of the night or during the daylight hours of the place where they actually are abroad. That makes a difference in terms of when you see a physician, right? So these are things that you want to take into account. Number 15, are there times set aside for the doctor to take phone calls? Also, does the doctor accept email questions? And is there a charge for this service? So those kinds of things you want to know ahead of time, because one, it makes it a lot easier. What I've heard from a lot of people is it's usually a positive experience. And what we found is that a lot of people abroad have reported that they've had home visits from physicians. They've had physicians call them directly or use WhatsApp. WhatsApp is much bigger outside of the US than it is in the US, but certainly the physicians are calling, not even their secretaries, they are doing the calls themselves. So that's something that you want to think about. You had a question. Are there similar international privacy laws for my medical records similar to HIPAA? This is country specific, D. So you'll find that most of them do have privacy laws. How close they are maybe to HIPAA in the US, that remains to be seen. But you usually can find that information online. It's usually available at any Ministry of Health for any country. We're finding that as a lot of countries move towards digital health, meaning like your records are becoming digitized and moving away from that paper, you'll find that there are more laws with patient privacy that are in place, because obviously cybersecurity is an issue. We want to make sure that that's not something where anyone can access your records. So it is specific to the country, but many of them have these laws in place. Many countries. And my day job is working globally with a number of health systems across the world, and many of them have them. Are they as stringent? In some places, it might be a little bit more stringent than others, but they do have privacy laws in place. Absolutely. Good question. Thank you for that. Where was I? Number 15? No, number 16. Does the doctor ever make house calls? That one is important because honestly, if you're a person that might have difficulty maybe with movement, whatever the case, or you're just interested in having them make house calls, that's something that you want to consider. You can ask that question. It's actually more popular outside of the US to still make house calls rather than in the US. Here, I think they call it, in the US, they call it, what is it? Concierge service now. Doctors are calling concierge service. And I mean, you pay a pretty penny here to have a doctor make a house call, but it's part of the norm in other countries. So you want to ask that ahead of time. Number 17, who takes care of patients after hours and when the doctor is away? This is important, guys, because honestly, after hours, if you do not have access to that particular physician, like a lot of times you'll find that doctors outside of the US, they'll give their number, they'll give their personal cell number, which is unheard of. But if you do give that number, if you don't have that number, you do want to know, where are you? Am I to call your office? Is there some after hours phone number to call so that someone can call me back? Or what do I do? Am I supposed to go to someone else? And the thing is, if it's an emergency, you need to know. But even if it's not an emergency, but something of concern, that's another reason why you want to know who is taking care of those patients after hours or when the doctor is traveling. Maybe they may go away for a conference, travel, vacation, whatever it is. So that's a question that you need to make sure that you're asking. Okay. Number 18, how are referrals handled? Okay, this is important for a couple reasons. So generally, physicians like primary care, family practice, internal medicine, those physicians may refer complex cases to some of their colleagues if they're not equipped to provide certain treatments. So if you're concerned with a scenario where you're referred to another physician for treatment, you should inquire as to the specifics of the referral process. Don't think that you understand it, that you know it. It's completely different than what you've probably been exposed to, okay? So this will help you prepare as much as possible prior to traveling rather than any unexpected surprises when you arrive. Because the other piece is you want to know if there's any monetary things that you need to be aware of if you are referred, okay? That's really important because then again, if you were quoted XYZ for X number of services, but then you get there and they find that it's something that's a little bit more complex, or there was it was a challenging case, or even something came from it, there was some type of complication, a referral would need to be made. Okay, well, how much is that going to cost me? Because another thing is these things cost money. It costs money, and a lot of places will not allow you to leave a hospital unless that money is paid, or they won't see you if you're coming in for something. Maybe you had a procedure done, you went to a hotel or wherever you're recovering, and then you have to go to an emergency room or something like that because there was a complication. In those cases, they want the money up front. Okay, so that's really important. Tanisha, let me see, make sure I'm not missing questions. If I go through the new country medical services to set up my medical needs, would that be better to have someone speak on my behalf? I want to make sure I understand this. If you go through new country medical services, what do you mean by new country medical services? Because if are you talking about only insurance and going through someone there? Because a lot of times it's obtain the insurance and you're still doing everything yourself. So I want to make sure I understand that. If you can provide me with a little bit more information, Tanisha, on that question, so I can better answer it for you, make sure you do that in the chat and I'll answer that. Okay, so that's referrals. Number 19, treatments offered. And this is related to referrals as well, but you want to know what treatments are offered depending on why you're even seeking a physician. Not all physicians or practices offer the same services. So if you're looking for a specific treatment or product brand, it's imperative that you inquire as to whether a given practice actually caters to it. And I'll give a dental example only because I recently heard this one. If you have seen advertisement for these clear alternative braces, Invisalign, that if you're interested in having that, although your dentist may offer invisible braces, an invisible braces solution similar in the function, the quality, everything to Invisalign, they may not be certified to provide specifically Invisalign. Okay. Invisalign has trained orthodontists for their product. So if this is something that's important to you, making sure that you have the exact name, brand, that sort of thing, then it's something that you need to consider in your search. You need to make sure that you are looking into exactly what's being offered by that particular physician. Okay. Okay, Tonisha provided me more information. If they have a medical concierge options available. Okay, so if you have medical concierge, and there's also medical tourism facilitators, which are very similar to concierge options. Let me see. Hold on. Medical concierge options help you set up your medical needs in a new country. So there's a concierge and there's also medical tourism facilitators. Very similar, but they are still different. Medical concierge are usually in that particular country and only deal with that people coming to that country. And they may only deal with a particular physician or hospital or type of procedure. Medical tourism facilitators are usually multi-country medical concierge, if you will. They're like a travel agent, but for medical tourism. So they can tell you any country, any procedure. They usually specialize in a particular region or a particular type of procedure. And then they kind of say, oh, this is my list of really great options. Which would you like? And go through it. But medical tourism facilitators handle everything for you. I mean, the flight, the recovery, picking the physicians and the facilities where you're going to do it. And they ensure that they're certified. They do all of this legwork for you. And it's usually for a cost, and it could be for a flat rate, or it could be a portion of the rate that you would pay whoever you're going to see. And then usually it involves some type of surgery when medical tourism facilitators get involved. Medical tourism facilitators, you won't really find them for things like primary care and stuff like that. I'm not saying that they can't do it, but what I'm saying is that they're typically used when you're going for treatment or you're going for a surgery. Okay. And they do everything. I'm trying to see if I can get a medical tourism facilitator to come on for me to interview, because I did an interview with Roshida Dow on her channel, and there was quite an interest from a number of people who thought, maybe I'll transition into that role, So it's something that I know you have to go through a series of certifications for. You don't have to go to school, but you go through certifications and you can become one. Okay. Medical AC. How do you find a medical concierge? Many that I've come across seem like salespeople. You're right. Honestly, I'm not as familiar with medical concierge, that process, because to be honest with you, you'll find that a lot of medical concierge, they may be recommended by a facility or by a clinician. And if you're going to go with that clinician, there's nothing wrong with you taking the one that they may have referred, right? But I'll start, like I tell everybody, you can have a PhD in Google. Start with that and look for reviews, because the concierge is a little bit different, but you can go off of word of mouth a lot. And then again, the medical tourism facilitators, they usually have their own company, or they may be a part of a group, similar to how a travel agent would be a part of a travel agent group. There are medical tourism facilitator agencies, and you can find someone there. And Google, Tonisha also asked about how do you find a medical tourism facilitator. Literally Google medical tourism facilitator. You're going to see so many people pop up. And there was a gentleman on YouTube, I did ask for him. He has a medical tourism company where he trains them and certifies them. And I did ask him to come on this channel so I could interview him, because so many people were interested, and he declined the interview. Unfortunately, he said at the moment he's been taking too many interviews, so not right now. But I still refer people to his channel because he puts out a lot of stuff for free, where you learn a little bit more about what medical tourism facilitators do and what they should be doing and what they don't do and that kind of thing. Let me see. I'm actually going to look him up right now and tell you. Medical tourism. Hold on. Yeah, his name is Gilliam Elliott. Now, I have no affiliation with him, but I send people to his channel a lot, Medical Tourism Business on YouTube. Okay, so how to become a medical tourism facilitator without experience. I'm going to put this one in the chat. Hold on. copy this link. I'm going to put this in the chat for you guys. Check out his channel. Because honestly, there's medical tourism facilitators for any country and for any procedure. Okay. It's about what you feel comfortable with, because you need to feel comfortable with them, because they are with you literally before you leave your country. They're not traveling with you, but they're essentially taking care of everything on the ground for you, your location of where you'll recover even after. They call you, they speak with all the clinicians during, they can even be there on the phone or virtually for your visits before you travel or while you're there. And even once you return, they also are checking on you to make sure everything's okay. They make sure that you're following the protocol, because if you, depending on what you had done, they make certain that you're not flying too early, that you're comfortable, that you follow all of the recommendations to walk and to all these things. Okay. So that's something that you might want to consider. Yeah. What is this? The groups you are in on Facebook. Oh, depends on the country you're going to. Okay. Yeah. Thank you for that, Tanisha. Okay, so let me get back to, okay, so number 20, last question, but I have other things for depending on certain populations. What's the process for urgent or emergent care? I mean, how do I reach the doctor in emergency, or should I go to the nearest hospital for care? So some practices offer flexible hours, flexible after hours and weekend appointments, whereas other practices may have some limited flexibility. So in those cases, what you do, should you go to the nearest emergency room in a hospital, and does it matter which hospital the doctor admits patients to? All of this is something that you need to ask, because it's important for you to know for a few reasons. The location of the hospital matters for your safety. It may be something close to the doctor's office, but it may be something in a completely different area. Is that an area a safe area, or the surrounding areas, is that safe? And is it safe for you to travel at night there, for transportation reasons, but also for insurance reasons, depending on your insurance? That matters as well. You may have the emergency. Some will cover you because it's an emergent situation, and some may say, no, we only cover if you go to these particular facilities. So these are the reasons why you need to know ahead of time what the doctor uses, the doctor that you plan on selecting, what they use. Okay. All right, those are the 20 questions. I can do a recap, but let me get into specific populations first, because I think this is important. So I'm going to talk to the LGBTQ plus community here. I am going to encourage you, do what you want, but I'm going to encourage you to share your gender at birth with the clinician when you're looking for a clinician. Okay, this is very important. And let me give you some context with this suggestion. If you live in the US, you already know there are laws in place to account for discrimination against anyone based on age, race, ethnicity, gender, sexual orientation, disability, whatever. But whether or not they're enforced, you have that right to pursue legal action if you believe your rights have been violated, right? Because this is not generally the case in several other countries, I just want you to not get caught up in that fact that some clinicians are light years behind when it comes to treating certain groups. And physicians here in the US are still struggling with providing adequate care for the LGBTQ plus community. So please keep that in mind. In order for you to obtain the best care, please just share your gender at birth with the clinician as you talk through whatever care, treatment, or procedure you're seeking. Okay. And have them also, you can also share how you'd like to be addressed, whatever pronouns, whatever it may be. But I just implore you to share that information, because it does matter in how they treat you. And I would guess that, and I think it's a pretty good guess, that if clinicians here, which I think in med school, they should be incorporating patient-centric care to be inclusive of all groups and all segments. And it's not right now, where you have certain acts and regulations in place. You better believe that in a country that doesn't have these things in place is not thinking about all those things. So I do just want you to, I just think about the best care. That's the emergency department in me. When people used to come in the emergency department, literally be having a heart attack, and we'd be taking out their wallet to show me their insurance card. And I used to be like, no, I don't care what insurance you have. I need to take care of you, because I don't care. I don't. It's about providing you with the best care available. And I want to make sure that if you're going to seek care abroad, that you are doing what you can to obtain that. Okay. So that's specific to the LGBTQ plus community. I think it's important. Those seeking surgery, if you are planning on traveling, it could be for cosmetic surgery, it could be for surgery related to a particular disease process, whatever it may be. There's certain things that are specific to Blacks that I definitely need you to be aware of, to bring to the attention of whoever you are interviewing to be your physician. Ensure you ask if they have any cared for any Black patients. And if so, ask for before and after pics. Okay. If it is a skin issue that you happen to be going for, or it's of concern, you want to know, you may have a history of a skin issue even, but you want to ensure you ask this and ask to see any testimonials and also any pictures of melanated patients. Ask if they understand or have treated things like keloid skin, because although keloid skin does not only affect Blacks, it affects Blacks more than our white counterparts. So you do want to see before and afters. You want to talk to them and see if they cared for skin that looks like yours. Okay, it's okay to ask these questions. I'd ask them here in the US. I also recommend you speak about the timetable of your trip. If you're going for surgery, you want to know, depending on where you're staying and any other planned physical activities. Some people say they're going for something that should be really quick, so they're going to also do some sightseeing and all those things. You need to know, are you able to swim? And if so, when can you do that? Are you able to go to an elevated place? I don't know, maybe you're going somewhere and it's got high elevation. All of these things you need to know. You also need to know with your insurance about medical evacuation insurance. That is real, because if you are in a position where maybe they cannot account for some complications and it's going a little bit the way that it shouldn't go, unplanned, they may need to evacuate you to the nearest place that has maybe the resources or facility that's able to care for whatever is going on. So you want to ask those questions. Ask about the facility where you will have the surgical procedure, certifications of that facility and those clinicians that fall under that. And that's something that you can find out online at the Joint Commission. And I'll put that in the chat or the description later. But the Joint Commission, which typically does regulatory requirements and certifications in the US, they have the International Joint Commission, which is the international arm, which goes and does this for other locations outside of the US. And they make sure that everything is up to par for quality, the best quality care. And if people fall, facilities fall out of that, they are dinged. And that's the best place that I refer people to look before they even go. Okay, I want you guys to be really careful with that. It's so important that you do that. And then also any country-specific vaccines. Now, there may be some recommendations due to whatever procedure or treatment you're getting. And although like the US Department of State and also the CDC, they list a boatload of vaccines that probably are not always necessary for specific countries, but do your research. I urge you to bring it up, especially if you have any pre-existing condition or you have a compromised immune system. You will want to inquire with the physician that you're going to see that's in country about any recommendations they may have that are specific to you and your health situation. They may say, oh yeah, you probably should be up to date on your tetanus, be up to date on whatever vaccine. Okay, so those are things that you really want to consider. And then also when it comes to surgery, when you decide to have a procedure abroad, you should also research as much as you can about the procedure, because you're going to want to learn about various techniques, tools, and risks. Okay, make sure you're asking questions. Take notes when you're asking your surgeon. You need to be engaged in all aspects of what's going to take place with the procedure, especially if it involves surgery. And by that, I mean something like even asking about the incision. What type of incision? You don't have to know what that is, but you want to ask them so they can tell you. If you have to look it up, look it up. It's fine. Or ask about it. How big do they expect the incision to be? Where do they plan to do this incision? There may be a standard, but depending on your unique situation and your health history, the surgeon may have to use a different method. Instead of going vertically, they may have to go horizontal with their incision, like things like that. That is important. Also ask about any risks, including infection, expected downtime, complications. I also want you to ask about what to expect with recovery. I think that's really important. And that's inclusive of even your follow-up visits. So you know how much time you need to rest, how much time you need to decide before you travel back to your country of origin. And also, what does recovery involve? Does it involve not flying for a minimum of 10 days? Typically after anything that involves the chest or abdominal surgery, because of pressure changes in a plane, they don't want you flying for a period of 10 days or more. And these are all things that even if you had a medical tourism facilitator, they'd be telling you these things as well. Okay. So think about all of that stuff and ask as many questions as possible. With surgery or longer term treatments, things like maybe cancer or fertility treatments, again, research the facility you plan on having your procedure in. You can Google it. You can look up at the Joint Commission International, but also determine if you're going to work with a tourism facilitator or even a concierge, as Tonisha mentioned here as well. If you decide to coordinate on your own, I suggest you go to the sites like the Joint Commission International. And also there's a site called Patients Beyond Borders. They have a website. You can Google them, and I'll also leave them information in the description. But Patient Beyond Borders, they basically capture information on international hospitals and clinics. They recommend some, but they recommend some that meet like stringent criteria. They want them to be listed by the organization or the facilities. They must be accredited by a reliable, globally recognized accreditation organization. They must be in good standing, meaning there's no legal claims or anything like that against that facility. The sites that they have, the websites must be in English. And this is only for Patient Beyond Borders. Like, this is part of their requirements. And it must be identifiable international services that are offered to patients. Also, key physicians and specialists must be listed on that facility's website. So a lot of times you'll find that if you are doing your own research, there are some times where a clinician might go to different hospitals, to do whatever procedures that they're known for doing. Well, Patients Beyond Borders says that these key physicians or specialists must be listed on the site, meaning that facility is taking on the responsibility of being accountable for that particular physician, which I love. And then also full contact information must be listed on the site for Patients Beyond Borders to accept them for the criteria they set aside. And I absolutely love that. The more checks and balances that you can have in place, the safer I think you're going to be. Okay. Please share this website in the chat. Which website, Tonisha? You mentioned what? Oh, is it the Joint Commission one or Patient Beyond Borders? Let me share both of them. Hold on. Give me a second. I hope I can find it. One second. Patient Beyond Borders. Let me go ahead and find Patients Beyond Borders. Patients Beyond Borders. All right. Copy. All right, Patients Beyond Borders. Here you go. And then let me get the Joint Commission International. Hold on. And these two places I go to myself. The Joint Commission International. All right. The good thing about the Joint Commission International is I love on their website, you can literally pick the country and go under it and see every facility that's accredited by them, whether it's a hospital, a clinic, even labs, different places. Let me put that one in now. All right. I just entered the Joint Commission International, and I use that one probably more than Patient Beyond Borders, because if you're looking for a facility, you start there, because what happens is with the Joint Commission International, physicians that work at those facilities must keep their credentials up to date, and they must meet those credentials. So I feel like it's killing two birds with one stone when you start with the Joint Commission International. The Patient Beyond Borders is great. It's just an additional site for, if you're looking for additional information. But I always start with the Joint Commission International. Okay. And then for me, I want to round this out by saying, determining where you go matters too, especially as a Black woman, depending on what type of procedure and where you are willing to travel. I know a lot of people, due to proximity, Americans tend to go to Central America or the Caribbean, but Black women need to consider how friendly a country is to Black women. How are Black women treated in that country? You want to know if there are any safety concerns. I always advise, whether or not you're traveling for a procedure, to always have someone with you that can serve as your advocate, specifically if you're going for any healthcare, right? If you have any complications or you're unable to speak, it's important that you have someone with you that will ask the right questions and remain on top of things, okay? So you're going to want to know, are you going to a country where they look down on women? You as a patient are in a vulnerable position. The last thing you need to worry about is whether, you'll face ill treatment from staff or locals as you recover. Maybe you're going to recover in a nearby hotel or some kind of recovery residence. All of those things matter. And also from a safety perspective, are you going to a country where a woman should always be accompanied by a male? You need to know this before you travel. Or if you're part of, say, the LGBTQ plus community and you travel with your partner, if something happens to you, will they allow your partner to speak on your behalf despite you identifying them as your advocate before you start any treatment? Because of this country's, maybe their general outlook on that community, like, these are things to consider. Think about these things. So I recommend 2 videos to Black women when thinking about where to go. Both are by Stephanie Perry. Worst countries for Black travelers, Black women abroad. Let me get that video. Hold on, I think I have a copy here. Hold on, I'm gonna put it in the chat. I know, Tanisha, I'm on it. You told me put it in the chat, I make sure. All right, I'm hoping the link will show up properly. Let me know. If not, Stephanie Perry's channel. But that video was a follow-up to another video, which I also suggest to people, countries where Black travelers feel welcome. And with that one, let me see. Make sure. I think I have a link. Hold on. That one, what is that one called? Yeah, countries where Black travelers feel welcome. And I always tell people, take a look at that too, because it should help you narrow down where you want to go based on what Black women have already traveled there. And it's not necessarily those 2 videos that I recommend, they have not actually traveled specifically for medical treatment, but that's good. I think that's a good thing, because if Black women are traveling there and they're not treated well, why give them your money, right? If in general they're not being treated well, bypass. It should make your decision that much easier, okay? So I always use those 2 videos and share with anyone before they make a decision about where they're going, all right? Let me see. So, all right. So tell me if I missed anything. Let me recap. And then if there's anything I may have missed, put it in the chat. Let me know. So number 1, I'm just going to recap. You want to know basics. Is the doctor taking new patients, right? 2, does a doctor accept your insurance? And in some cases, your US based plan may cover you abroad. It may not. You may need to get something local or international plan. Consider that. Number 3, is the doctor a preferred provider under your insurance plan? You need to know so that hopefully you're not surprised with any out-of-pocket expense that you didn't anticipate. Number 4, you want to know if that physician is board certified and whatever qualifications they have and in what field. And then number 4, sorry. Number 5, is the age, gender, race, or religion of the doctor important to you? If it is, those are things that you need to determine ahead of time and try to find or narrow down your list based on what you're looking for. Number 6, will language be an obstacle to communication? So you want to make sure that someone in that office speaks your language. We don't want to leave anything up to interpretation, but then also consider the fact that there may be a higher cost, depending on where you are, for whatever language you want spoken to be spoken. Okay, specifically if it's English, a lot of times they cost more. Number 8, do I prefer a group practice or an individual doctor? May not matter to you either way, but again, if it's something where you have to consistently and frequently see a physician, you might want one, or you may just say, as long as someone in the practice is available, I'm good. Okay, think about that. Number 9, how far in advance do I have to make appointments? Critical, because you don't want to wait a lengthy period of time, right, to see a physician. So that's important. And then we get into the location. Number 10, is the location of the doctor's office important to you? How far are you willing to travel to see that doctor? What does it cost you? Is the office on a bus or a subway line? Is Uber or other transportation costs going to be too much for you? Is it within your budget? You just want to know. And if you're driving, parking situation, is there a place to park? Those kinds of things. Number 11, you want to ask what services they offer in-house, because obviously if they're going to need to do a full workup, blood work, imaging, whatever, even having pharmacy on site, you want to know, because that will be more convenient for you. If it's not on site, it's fine also, but ask them where they recommend or send their referrals for pharmacy or for these particular tests to be done, so that you are not going all over the world and you're keeping your costs low and you know exactly what you're doing. Number 12, cost. All of the things I mentioned, the transportation, where the office is located, what's in-house versus not. Are you traveling from maybe a rural area to a more populated area like the city or a main the capital of that particular country? All of those things need to be considered or factored into the cost for you guys. And then number 13, does the building have an elevator? So we're talking about, are there ramps, accessible by wheelchair walker? If you're from a disabled community, you have physical disabilities, these are things that you need to know and consider in advance. Also, you want to know about the doctor's policies. Number 14, what days or hours does the doctor see patients? That's important for you. Also, number 15, are there times set aside for the doctor to take phone calls? Does the doctor accept email questions, which is would be ideal? Is there a charge for this service? Many times they will contact you honestly on WhatsApp and just speak to you rather than write it. Number 16, does the doctor ever make house calls, which is very common outside of the United States, in some countries more than others. If that's important to you, you want to know. Number 17, who takes care of patients after hours and or when the doctor is away? You want to know if they're in a group. Honestly, that shouldn't be an issue, but if they're not in a group and it's solely one doctor for the practice, you do need to know what your alternatives are, okay? Number 18, how are referrals handled? Big deal for you, because you don't want to be surprised that maybe a clinician can't handle this case and hands off and you didn't even know. Ask about referrals so you understand the process and you understand the money that's coming with that, that's attached to that decision, okay? Number 19, the treatments offered. Obviously, not all physicians or practices offer the same services. You want to make sure whatever treatment you intend to go for is what you want to get. So you're asking about those specifically. And then number 20, what's the process for urgent or emergent care? How do you reach the doctor in emergency, or should you go to the nearest hospital for care? And does it even matter which hospital that your doctor admits patients to? Okay, all of those are key when you are seeking care abroad, whether you are just traveling specifically for the care, maybe short term. If you decided to move abroad, these are the questions as you're looking for someone ahead of time before you even hit the ground. Or if you are a digital nomad, as I mentioned, and maybe you're just sort of bopping around the globe and you will stay in one place a little bit longer than the other, you want to know exactly what to look for. Okay, so I hope I have answered all of you guys' questions. Let me double check. Yeah, we will watch the replay. Okay, Tanisha, thank you. You're going to watch the replay. I appreciate that. Hi, Shondine. Hello, that's my sister-in-law, guys. Lots of information. Thank you for sharing your wealth of knowledge. My pleasure. So if you guys have any other questions or comments, feel free to leave it in the chat, and I can hopefully answer it. And also leave any information that you may want me to cover outside of this. This was something that was highly recommended when I had other videos. Someone commented and said, could you cover that? I'll be taking a lot of your recommendations for future lives. If you want me to come back and answer that, I definitely will do that. That's something that I probably have more time for than actually recording and then uploading the video. So I will certainly do that. But thank you guys for joining. I appreciate it. If you haven't hit the like button, hit the like button, subscribe, and hit the notification bell. So whenever I drop a video or I'm live, you guys are aware. Okay. Until next time, be well. Thank you guys. Bye. Take care.